Hello everybody, today we'll be doing a induction for a laparoscopic chole. First I'm going to be doing a preoperative assessment with my patient. I just want to flash over to my notes real quick here. So we're going to do the pre-op eval. I'm going to head over to meet my patient. I'm going to introduce myself. So I'm going to go ahead and talk to them. So hello ma'am, how are you doing? My name is Joel. I'm your anesthesia provider today. We're going to be doing a laparoscopic chole. Can you tell me why you're here? What brought you here? So you have the right upper quadrant pain, correct? Great. So we did the ultrasound to confirm you do have cholecystitis, and so we're going to be doing the cholecystectomy to remove your gallbladder. Okay. Really quickly, I just want to ask about your medical history. You have type 2 diabetes, correct? And you also have GERD. Tell me a little bit about your GERD. Like, how do you require any pillows to sleep? Is it after food? Is it just random? Okay, so you say it's random and that you use, what, 2 pillows to sleep at night? That's pretty severe. Do you take anything for that? Okay, you take omeprazole, 40 milligrams, great. Did you take it this morning? Great, that's great. What about your diabetes? I'm seeing your A1C here is 6.5, so it's pretty well controlled. You take metformin, correct? Yep. All right, so then I'm looking at your BNP panel, making sure your kidney function is appropriate since you're on that metformin. Looks good. Creatinine, BUN are normal. Your potassium here, it's a 4.0, so that's appropriate. Electrolytes are all normal. Great. And so I would rate you as an ASA class 2 because your chronic conditions are well controlled. And so let's proceed to maybe your airway assessment. So I'm gonna go ahead and look at your mouth. I'm gonna look at how wide your incisor gap is. So I can fit at least 3 finger breaths in there, about at least 4 centimeters. Thyromental distance, I can see that it's at least 7 centimeters, so that's appropriate. I'm gonna go ahead and check your neck mobility. Okay, so you have good neck mobility, a good range of motion. You're only 50 years old, correct? So you don't suffer from any sleep apnea. Okay, nobody's told you that you snore, right? Your teeth, your dentation seems to be like you're not missing any teeth. You don't have any kind of implantable hardware, right, where you put it in or out. No, that's good. Okay, so I'm gonna go ahead and do your Mallampati score, right? So I can see your tonsillar pillars, your uvula, your soft and hard palate. So I would rate you as a Mallampati 1. So I don't anticipate a difficult airway. We'll be doing, since you are a high risk for aspiration due to your reflux, and your BMI is just slightly overweight, you're about 29 on the BMI, about 79 kilograms for your height of 5'5". So I'm comfortable with doing endotracheal intubation today, which means that we're gonna paralyze you, we're gonna sedate you, and it'll be, I'll place an endotracheal tube in your airway that'll protect you from any kind of aspiration. Sometimes when we give these medications, it can cause vomiting. And so just wanna make sure we protect your airway. I'm gonna be using a size 7 tube for you today. And so I'm gonna have a size up and size down, but I'll cover that once we go to the machine check. But once I've done my airway assessment, I feel comfortable in discussing the risks and benefits. And so we're gonna cover things like, anytime we're doing intubation, there's a risk of airway damage, sore throat, teeth oftentimes become chipped. I'll try my absolute best to not cause any kind of damage. You might have a hoarse voice after. I'll be as gentle as I can. Post-operatively, you might have some post-operative nausea. Have you had any surgeries in the past? Okay, so you've had surgeries. Did you have any kind of reaction to that? Any kind of nausea? Any kind of adverse reactions? Okay, so you had a little bit of nausea. Okay, so I'll make sure to pre-medicate you before the case is done to make sure to prevent that, okay? And so I just wanna pre-medicate you for that. Like I said, your BMI is around 29, and so that places you at a slightly higher risk for aspiration, okay? So we're gonna be using cocktail medications of like propofol and succinylcholine as a rapid sequence intubation, RSI, and we will be placing you in a supine position. We're gonna pad your ulna, we're gonna pad your heels, and then at some point the provider is gonna inflate your abdomen with like CO2 or air, and that might cause a risk of embolus. And we will put you in a steep Trendelenburg position to kind of displace the kind of your intestines, so we can get a better visualization. And that's actually going to be a reverse Trendelenburg, actually, because we want to have the liver kind of come out and to visualize the gallbladder better. And labs wise, everything looks good. Your electrolytes look good, potassium looks good, which is a primary concern with succinylcholine. And so I feel confident. So once we've done that pre-op eval, I'm gonna have you sign your consent. We've gone over positioning, risk benefits, your BMI. I'm gonna go ahead, and we've done your airway assessment. I'm gonna go ahead and go back to the OR, check my machine, and then we'll wheel you back, okay? All right. So I'm gonna head over here to the machine check. I wanna make sure that I'm checking my pipeline pressures. I wanna make sure I have at least 50 PSI on my pipeline. And I wanna make sure that I have at least 1,000 PSI on my O2 cylinders and 745 on my nitrous oxide. Great. So then I'm gonna head over here. I'm gonna check my vaporizers, making sure that they're filled to the appropriate level, making sure I have auxiliary oxygen present, I have suction present, so a Yonker with suction. I wanna make sure I have my ambu bag and that it's able to hold pressure, which is appropriate. I'm gonna go ahead and do a low pressure test, checking my Thorpe tubes, checking my interlock mechanism as well as my vaporizer levels. I'm gonna turn on the machine. While the machine loads, I'm gonna look at my monitor. I'm gonna make sure I have all my parameters set. All my, that includes like my blood pressure cuff. I have my SpO2, my EKG leads, my end-tidal CO2. I want to make sure I check my oxygen sensors. Once the machine turns on, I would calibrate to room air and 100%. I would want to check my unidirectional valves. I want to check my my bellows, making sure that it's able to fill appropriately. So I'm gonna go ahead and like flush the system here and have my bag. I'm gonna occlude the Y piece and inflate my bellows, making sure that there's no leaks, as well as my reservoir bag, making sure there's no leaks, that it's able to hold pressure for at least 30 centimeters of water for at least 10 seconds, which it does. There's no holes in the bag. The tubing looks good. It's not kinked, so that's appropriate. I'm gonna make sure that I check my scavenger system, making sure that it's at least 10 centimeters of water. And I wanna make sure I check my CO2 absorbent, making sure that it's not desiccated and it's not purple. And this one is not, so good. I'm gonna make sure to put my mask back on before I head over to see the patient. I also wanna make sure I have all my tools ready for me. And so I wanna make sure I have my APL at open as well. And so I want to make sure I have my blades ready. I'm going to be using a Mac 3 blade for this patient, but I also have a Miller 2 just in case. I want to make sure that my light is working appropriately. I want to make sure I have my airway supplies. That includes various sizes masks to make sure that I can ventilate the patient. I want to make sure I have various ET tube sizes. I'm going to be using a 7.0 for this patient since she's 5'5". 7.0, I want to have a 6.5 and a 7.5. I want to make sure I have an oral airway just in case, multiple size oral airways, multiple blades, and I want to make sure I have my apples. That includes my atropine, phenylephrine, propofol, lidocaine, ephedrine, and succinylcholine as a rescue med for laryngospasm. And so I just want to make sure that I have all my supplies, I've checked my machine, I can go get my patient. So we wheel her into the OR. She's in the supine position. She has 2 peripheral IVs. She has bilateral 20 gauges. They work appropriately. So great. I am good on that aspect. So I'm gonna grab my blade, I'm gonna grab my ET tube. I'm gonna head over here to the patient. Great. So you always want to make sure you hyperoxygenate the patient. You want to denitrogenate them. You want to make sure they have this patient is slightly overweight, so they might have a decreased FRC. And so you just want to do this CE technique here on the patient. We've hooked them up to the monitor. Right? We have vital signs going right now. I'm getting capnography from her breathing out. I want to make sure that her position is in a sniffing position, optimizing my visualization of her, her oral. I want to make sure I visualize appropriately. I want to be in a comfortable position. So once we've hyperoxygenated her, I'm going to go ahead and grab my medications that I'm going to give. And so I'm going to go ahead and give my propofol. I'm going to give my propofol. I'm going to give my succinylcholine. I'm giving 2 milligrams per kilogram of propofol. I'm giving 1 milligram per kilogram of sux. So 140 of propofol, 70 of succinylcholine. I've checked her potassium, so there's no concern there. She'll probably become, the propofol will take maybe like a minute, 30 seconds to really kick in. In about a minute, she will be paralyzed as well. And I would have ventilated prior to giving the paralytic, just to make sure that I was able to ventilate. And so I've already given the medications, we're good. I'm gonna go ahead and I'm gonna place my blade inside, washing the teeth, maybe holding the head, sweeping the tongue from right to left. I can visualize the cuneiforms and the corniculates. I have my ET tube here. I would advance from right to left, visualizing the passage of the cuff through the cords, and then I'm able to retract the blade. I'm able to inflate the tube. I'm able to place my circuit on the patient. The depth is at around 21 centimeters for this individual. 21 centimeters, and I would be checking before I secure. I see fogging of the tube. I see end-tidal CO2. I would have my assistant hold the ET tube in place for me. I'm gonna go ahead and listen to bilateral breath sounds, as well as over the epigastric area. I don't hear any kind of sounds as I bag patient. And so after this, I'm able to secure the ET tube in place. So to secure the ET tube. ET tube is secure. I'm securing the eyes, making sure that we prevent any corneal abrasions. I'm turning on my gas. I'm gonna do SIBO at 2%, and then I'm gonna go ahead and I would bag the patient, overpressurize, maybe like 5 breaths, just to kind of get the FI up. And after that, I should be good for surgery. I'm looking at my vital signs, looking at my capnography. I've confirmed tube placement. I believe we're ready for surgery at this point. Thank you.